Welcome. Tricia Coffey is joining us today on The Gist. Tricia is a social worker who works at Franciscan Children's Hospital. Thanks for being with us today, Tricia.
Thank you so much for having me. I'm very, very excited to talk about the initiative today.
Yeah, so let's get right into it. The initiative, we were talking about youth mental illness. Tell me a little bit about what you're working on.
For sure. So this is a new partnership with the Archdiocese of Boston with Franciscan Children's. And our initiative's called the Kids Healthy Minds. And we're focusing on early detection and intervention for youth and families to really understand the early warning signs of youth mental illness and then provide the supports and understanding for community awareness.
Okay, so this is really important stuff. I know as a parent myself, and seeing some of the things that teenagers go through and some of the things my children have been exposed to through their friends struggling with various forms of mental illness. It can take the form of depression or anxiety. These are scary things to parents. How do you begin that conversation? Like, what is your recommendation, just to your average parent perhaps, who's not an experienced professional like you? How do you begin that conversation with your kids?
Sure. I think that it's important to really normalize that it's not easy to detect youth mental illness. So education's key. And it also ties into our own attitudes and beliefs about youth mental illness. And that stigma can be a large barrier for youth that are experiencing mental illness, whether they're hiding their symptoms from their peers or their families, their teachers, or if it's for parents that are experiencing stigma, where they feel like they can't confide in other parents or even their own family members that their child's going through this mental illness.
Yeah, that's a really tough obstacle, isn't it? Because when, say for example, my son was hospitalized a few years ago, we had neighbors and friends coming out and supporting us, bringing us casseroles, they're doing all the things. But I think there is that stigma there with mental illness. You're not going to go out and tell the world, my child's really suffering with this. And how do we get past that?
Absolutely. And I love that you mentioned that, because we actually call it the no casserole disease, youth mental illness.
You don't get a casserole for this one.
There's no blue ribbon casserole awaiting your doorstep. Right? And I think it really stems from a lack of understanding that this is a pediatric mental illness disease, and that we can really support families just as we do if someone's diagnosed with juvenile diabetes, or if a child's coming home from the hospital for a sporting injury. We know that early treatment and detection, that's going to give you better outcomes.
Right. Okay, but what about if you're thinking maybe your child's you're concerned about their behavior, or, and I've had this happen, that your child has a friend who might be confiding in them. There's confidentiality issues there. Like, how do you navigate that? Like, what would you advise to young teens who are interacting with their peers? They're afraid of tattling on them.
Yes, absolutely. Really understanding that if someone confides in you and is saying something alarming, that there are symptoms of suicide or that they're planning on harming themselves, to find a trusting adult, and that's key. I think one of the biggest protective factors for mental illness is adults, loving, caring, compassionate adults that children can trust, whether that's a coach, a parent, a teacher, someone in their life.
Somebody that they're able to confide in. So we should be telling our kids to be open to what their friends might be sharing, but then having that open relationship with our own children.
Absolutely, yes.
Okay, now, so this program, the initiative is called Kids Healthy Minds?
Yes, Kids Healthy Minds Initiative.
Who exactly is that serving?
Yes, so it's serving all of the children, families, clergy members, pastoral staff, teachers in the Archdiocese of Boston. And where it comes from is a really amazing event that happened at Franciscan Children's. And if you're not aware of who we are, we're a nonprofit Catholic hospital right here in Boston, and we provide numerous services: complex medical, mental health, as well as educational services right on site. And we're one of 4 of hospitals nationwide that provide all these services.
That's amazing. So, you know, if there's somebody who's interested in maybe supporting the initiative or getting more information, maybe they have somebody who they think might need some help in their lives that they love, where can they get that information?
Absolutely. So KidsHealthyMindsInitiative.org That's our email. You
Okay.
can email us with any questions. We also have a mental health resource line where parents can call and consult with us if they have some concerns of their child or
excellent.
peers.
Yeah, because sometimes you just want to ask somebody, is this normal or should I be concerned? And what a wonderful resource that is.
Yes.
So thank you so much, Tricia, for coming in, for sharing about the important work you're doing and the ways that we can access the resources that are out there. But thank you especially for the important work that you're doing for young people in our community.
Thank you.